you.
Good evening. You're watching Live with Faye. Thank you for joining us on our YouTube channel, which now has 104,000 followers. So thank you for everyone who clicked your like, share, subscribe buttons and followed us on YouTube. Every day we host a discussion at 8 p.m. on issues we believe are of utmost importance in the country. You'll find very often that these issues that we pick are different from what's being picked by television channels. That's because our priorities are different. We consider COVID and the economy and our relationship with China, the key stories developing in the country right now. Today's story has to do with what's going on in Parliament. But before I get to that, I want to just thank all of our viewers who come in on a daily basis. Sheldon Pereira, Nature Lover, Krishnashish Datta, Bharat Rawal, all of you who come in every day and give us support. Ritin Avasti, thank you so much. Ankit Gupta for coming in and giving us your support. It means a great deal to us. We're a very small team. And all of these steps are about how hard we have worked, and it really drives us. Getting straight to the conversation that we're at today, we know that there is a session of Parliament that's on. It is a truncated session. It's a shorter session than we would normally have in the monsoon session. You also know that we brought you the story of the question hour, which is a point where anybody in Parliament can ask questions of the government, and the government has to give answers. And the person who has asked the question can actually counter question. Well, question hour was initially cancelled, and then it was moved to the government saying, hey, you know what, we'll give you the answers in writing. Now, while this is perhaps a midway point and it's some sort of concession, it's not a great concession because it doesn't allow for cross-questioning. And we've seen the government's answers, quite frankly, be fairly inadequate, given the questions that were asked. For example, the first question that was asked of the government is details of migrant workers as they were, who had traveled back to their villages, how many had traveled, how many had died on the way, and if there was compensation. The government's answer was, we don't know. And there's no question of compensation because we don't know how many migrant laborers have actually traveled. And there was a certain amount of unhappiness with that answer. But the next answer that came to the second question was actually deeply distressing. The government was asked how many healthcare workers, doctors, nurses, ward boys, ASHA workers had lost their lives to COVID in the last 6 months, and has the government given them compensation? The answer was more than inadequate because the ministry actually turned around and said this data is not maintained by the central government. It's actually just maintained by state government. So we don't really know how many doctors, nurses, or ward boys have died of COVID. And what's worse, it says there is a database of those seeking relief under the Pradhan Mantri Garib Kalyan insurance package. And of that, 155 healthcare workers have asked for relief. There's no confirmation of whether or not they've received that relief under that package. Now, the Indian Medical Association, quite rightly, if you ask me, took very strongly to that answer, and they were very, very upset. They have actually put out a strongly worded statement to that response from the health ministry. I'm going to read out a bit of that statement because it's so strongly worded that we should all hear it. And we should remember the fact that there was plate banging and bell ringing and candle lighting and flower petals showering for the healthcare staff because we wanted to be so grateful to them. And now this is what has happened. Now, reading out from the IMA statement, it says, the indifference to the sacrifice of doctors and healthcare workers in the reality of COVID is the reality of COVID-19. It appears that they are dispensable. No nation has lost as many doctors and healthcare workers as India. Doctors suffer 4 times the mortality as ordinary citizens, and private practitioners suffer 8 times that mortality. To feign that this information doesn't merit the attention of the nation is abominable. If the government doesn't maintain statistics of the total number of doctors and healthcare workers infected by COVID-19, the statistics of how many sacrifice their life, it loses its moral authority to administer the Epidemics Act and the Disaster Management Act. This also exposes hypocrisy of calling them corona warriors on one hand and denying them families and them the benefits of martyrdom. While brave soldiers on the border continues the enemy as they do so with enormous risk to their personal self, none of them bring home the bullets to be shared with their families. On contrary, doctors and healthcare workers not only get infected in the line of duty, but also bring home the infection to their families and their children. To treat these martyrs indifferently is a national sacrilege. To tell these families and children to fend for themselves is the injustice of the highest order. Now, the IMA has also published a list of doctors who have passed away during this struggle, a total of 382 of them, just doctors. Remember, this is not the list of nurses, not the list of ward boys or ASHA workers, because that data, ideally, the government should have, but the government doesn't have. It is indeed a deeply sad day in India, where despite all of the sacrifices that our doctors and healthcare staff have made, this is the day we are at. I want to remind our audience, for those who will ask me every day, we made repeated attempts to bring in someone from government or someone from the BJP to this conversation. They have all denied and refused to be part of this conversation. Joining us this evening, Dr. Rajan Sharma, National President of the Indian Medical Association, Dr. Shruti Tandan from Jaslok Hospital, who has been at the forefront of this fight in the ICU at Jaslok since the very beginning, Dr. Sanjeev Bagai, who is a Padma awardee and who runs Nephron clinics, and Ravi Duggal, who is a public health activist. Good evening, doctors and Mr. Duggal, to this conversation, and thank you for joining us. If I may, with the permission of the other doctors, start with Dr. Sharma, who is from the IMA. We just read out that press release, Dr. Sharma. The government said that we don't have that data, the state governments would have that data, and argued that this is a state subject. Did you not believe that that was enough? Do you not believe the government should be given time to perhaps put that data together? What about that statement upset the IMA so much?
First of all, data we are giving them. We are authenticating and giving this data, so that it's readily available with them. And secondly, if anybody is familiar with the COVID testing, once you are to get a COVID test done, your Aadhaar card is uploaded. And there are various agencies who call up to verify. And ICMR clears these reports. So how can this data not be there? And the time has come. My biggest sorrow and contention is, are doctors going to be put in various state buckets? Are we national assets? COVID is a national crisis, entire world crisis. And it's high time. And this is with deep sorrow and pain I had to write this letter. That if the government says they don't have data, we have been regularly updating them with these data. Even with guidelines, these issues need to be addressed. IMA had to even fight for a right of a doctor to get a testing done, working in a COVID hospital. Everything is on record. IMA has more than 100 mailers to the Health Ministry and advisories.
Dr. Sharma, in the rest of the response, they also said that there was no problem of PPEs, that doctors were given access to all of the medication that was needed in order to keep them safe, that all of the facilities that doctors needed were given to them. Do you agree with that?
My contention is not the PPE kits. My contention is the quality of PPE kits. You wear one PPE kit and work in an ICU for 8 hours. And quarantine period, resting period. What about the nutrition and psychological needs of a doctor who is constantly working in a COVID place? And from day one, we have been stressing at IFA, one nation, one set of guidelines. And COVID is not sparing government or private sector. If I have lost 383 of my doctors, majority of them are general practitioners who have been exposed to silent carriers. And after I have started making this data public, people are calling out that we have not got compensation. The nation has to take a call. It takes 15 years to make a doctor, maybe 3 or 4 months to make a ventilator. Protect us, value us. We are fighting against all odds, putting in long hours sterlingly well. I'm proud of my professionals. The mortality rate is low. We have overcome that initial misunderstanding about the disease, and have set up fairly set standard protocols. IMA had demanded Indian medical services and let us manage and decide COVID management, these medical managements, as it is we who are inside the ICU.
Dr. Sharma, the government has also said that the Pradhan Mantri Garib Kalyan insurance policy is where these compensations are being handed out. Is this the only compensation being given to healthcare workers who have lost their lives? A Garib Kalyan insurance package?
Well, first of all, I take strong objection to this name Garib Kalyan Yojana. Is this the way to acknowledge your medical professionals? No. Every country, we are one of the leading countries in the world with so much of mortality. I don't have any problem with the word Garib. This is not the way things should be. Are we under some category or a scheme?
What is your demand from the government right now, from the IMA, Dr. Sharma?
My demand from the government is very lucidly mentioned in the letter. Yes. Treat us as martyrs. We are the only ones who protect our Indian army. We are national assets. Take care of us, take care of our families. We bring in the disease to our homes. I have scores of examples where my doctors' families have been infected. And when I get up in the morning, whatever it is, we need to sit together. It is not a blame game. I just want to draw the focus of the nation and the government to the fact that let's sit together, work together, and how we can lower this mortality rate amongst us.
Right. Thank you, Dr. Sharma. I know that you have to leave. So thank you for joining us and giving us the point of view of the IMA. Let me take the questions now to Dr. Sanjeev Bagai. Dr. Bagai is a very senior physician. Yes.
I will seek apologies. I had a very important con call, so all the other speakers, my due respects, please excuse me, and thank you, D'Souza ma'am. Thank you, and all the panelists.
Thank you, Dr. Sharma, for joining us. For the benefit of our audience, Dr. Bagai is a Padma Awardee, a very senior physician who's actually been talking to me through the course of this entire battle with COVID. Dr. Bagai, we've had conversations about, the mental stress this has put on doctors, the physical stress this has put on doctors. We know that, doctors and nurses who are repeatedly exposed in these high exposure spaces, which ICUs are at particular risk. What was your response to hearing the government say, hey, you know what, we don't know how many of them have died?
Good evening, Faye, all the panelists and all the viewers. Faye, with your permission, if I can just spend 1 minute just to give a very quick capture background. Doctors for a very long time have been the softest target, the most vulnerable targets in all fronts, professionally, legally, physically, in our community. We are almost a million short of doctors. And the data is very much there. It's not 350 odd of our colleagues, which we have unfortunately lost. This data has been published by Johns Hopkins on 3rd of September. I've already tweeted on it, of the global mortality, in which Mexico is 1,320, US is 1,077, so on and so forth. And India is reported as 573. This is effective of 3rd of September. I'm not going to base my discussion on a statistical number because a human life is not a number. But it takes a very, very long, strenuous professional battle in our own profession to reach a level of specialization. India has about 60 to 70% of general practitioners, only 25 to 30% are specialists. And these general practitioners are not associated with large corporate hospitals. So really speaking, they are lame ducks as sitting volcanoes waiting to explode. The data is there. I'm surprised that this data was not mentioned. What I would actually suggest is that this data from different states needs a comprehensive data analysis. We don't only need to document the number of deaths, we should also document in terms of all medical healthcare workers. That means doctors, nurses, paramedics, the ASHA workers, the sanitary workers. It's extremely important because they are also at high risk. We also need to document those who are positive but not needing admission, because we know the long-term impact of COVID is not only for the admitted patients who recovered, it can be equally devastating and lethal. Almost 50 to 80% of patients after recovery, even if you are at home isolation, continue to have symptoms, be it respiratory or neuro or cardiac or just body ache and fatigue. My real request is that we need, Faye, point number one is we need a national healthcare policy to look after doctors. We need a medical healthcare fund. This fund should look after the doctors in terms of an unfortunate demise. Their families should be looked after. It is our duty as a nation, it is our duty as a government, it's our duty as a medical fraternity to come together. We have to look after the doctors' medical insurance. We have to look after the doctors as terminal life insurance. We get nothing at the time of death, unfortunately, if a doctor dies. And especially if a doctor is in a tier 2, tier 3 city as a general practitioner, he's left for nowhere. The family is literally on the mat. We need to recognize these doctors who unfortunately lost their lives as honoring them. I don't want a designation. We are not asking for anything. Honor them, to recognize them so that the family at least has a comfort that the nation has recognized them. I think that's important. And lastly, most importantly, is that the most vulnerable are the junior doctors, the men and the women who are in their mid 20s, late 20s, who are attending to the critical patients in the ICUs. Let me tell you, even the people who don't have comorbidities are also vulnerable. So the young lot also is vulnerable. Comorbidities, of course, greatly enhances the risk of mortality and morbidity. An interesting data which was published by Journal of American Association of Medicine, which was just last week, is that the true analysis of fatality of COVID is 94% inaccurate. I will repeat that again. This has been published, it's there on record. Only 6% of deaths actually have COVID written, and 94% of the deaths don't have COVID written, whereas it could be associated with COVID. And 2.6 per death per patient is the level of comorbidities which exist. So I would safely say that the number of patients who've actually expired globally, this is not only India specific, would be a lot more if you really write COVID as a diagnosis because COVID was there. Now, if a person comes with hypertension or with kidney disease and you write CKD or with an MI and COVID is by the way, that by the way is important because that's what's precipitating the acute fatality. I think we need a digital mapping of this data. Please understand the last 60 seconds, Faye, is that this infection of COVID, which is a global catastrophic pandemic, is not going to go away in the next 1 month, 2 months. It's going to linger on and haunt us for many months, even into 2021. We know that the comorbid conditions and the lethal complications and the sequelae are going to linger on in terms to increase the morbidity for many years after COVID has gone. I think we need very, very sincere data tracking. We need data mining. We need to isolate and identify the people who have had, even at home or asymptomatically, but identify them so that they need a long-term follow-up, look after the medical fraternity, protect the medical fraternity, honor the young doctors who unfortunately lost their life. It's a sacrifice. Doctors live 8 to 9 years lesser than the general population, apple to apple comparison. And we are at a very, very high risk in managing these kind of patients. We are at a risk to infect our families, our old parents. We are at risk ourselves. A lot of the doctors are in 50s and 60s themselves. We also have comorbidities. We also are at risk, but we don't consider those risks because our duty, our ethics, our DNA is to treat the patient first. But I think we all need to rally together. My only request is that the doctors who've lost their lives, unfortunately, in fighting this infection, their families must be looked after. It's extremely important. In India, still there is a culture that a man is a single earning person. I don't want the young children or adolescent children to
Right.
have looking at a bottleneck. I don't want their wives to be struggling from finances. Look after them financially, look after them, at least give them some sort of reassurance that the nation stands for them and with them.
Right. Thank you for that statement, Doctor. Dr. Shruti Tandan joins us as well from Jaslok Hospital. Dr. Tandan, I know that many of the doctors and nurses who work with you tested positive. I know that was initially in the first month a very scary thing for your entire team as well. Given the number of people in your fraternity who've been lost to this disease, what is your reaction to the statement from government?
She's muted.
Dr. Tandan, you have to unmute your phone.
So while it's very unfortunate, I must
Yes.
admit that I'm not surprised at this statement coming from the government. I think both the speakers who spoke before me very correctly said that doctors have been soft targets, they've been the underdogs. There is a book called The Thorn Bird, which talks about a bird which sings sweetly throughout it sings sweetest when there's a thorn pricked in its chest, and it then dies of singing sweetly. If you read the back part of the book, and it then ends saying, "And still we do it." And I do feel this is very true of the medical profession, that knowing everything that is happening, knowing all the violence that was happening against doctors pre-COVID, even when people were banging thalis and showering petals over KEM Hospital, which really meant very little, and we've spoken about that. I had many of my young residents shrug their shoulders and say that in a week or 10 days, they'll forget about all this and they will be attacking us again. And I had little solace to offer because I knew what they were saying was the hard truth. And at that point of time, I think I did mention this on your show itself, that while it's good for me as a leader to motivate my team to move ahead, but at that point of time, one of my batchmates had pointed out to me that, Shruti, you keep saying that we are like soldiers and we should go to war. But are we being treated like soldiers? And that's precisely the point that Dr. Bagai made, that we are not given the same status. So there was a 50 lakh rupee compensation offered to a doctor who would lose their life to COVID, but there was nothing offered in terms of medical care. So there's a WhatsApp message on the name of one Dr. Sanket Mehta in Gujarat, which is making the rounds. Many of you may have received it, and how people are being asked to group fund his medical treatment. I think that's so unfortunate that a soldier who's battling with COVID today has his wife, his family has to ask people to donate money so that he may win this battle. I think that itself speaks volumes of what we stand for as a nation. Our administrative machinery has failed. No nation has had this kind of consistency of numbers, despite the numerous discussions and talks that we've had and the numerous measures suggested. I think the government has done precious little to contain the disease. I really wonder what happened to all those celebrities who came out on talk shows and spoke about, how unethical medicine is and how doctors are practicing the wrong way, and how sad it is, and people have cried on talk shows. I wonder where all of them are now, and why do they not come out in support of doctors or retract their statements? So at Jaslok, we've been able to protect our staff ever since that outbreak by being very, very stringent about the quality of PPE and the protocols about PPE. But when you look at public hospitals, I mean, we are talking about psychological support, we're talking about medical care. But if you go back, I have colleagues who are faculty members in public hospitals, and I have first-hand information that the residents there were not even paid. And some of my colleagues who are well-to-do knew that their residents are not getting paid, so they, on a first-hand basis, offered them loans. I mean, that's one of the saddest things, that in a lockdown where the whole country is indoors, you're going out to work, you're not getting paid. It's happened with a lot of doctors in private hospitals. Some of us have volunteered to work. So really, and by grace of God, we have some kind of savings. But what happens to the poor residents? So, it's all out there, and it's not that these facts are hidden from the government. And even before COVID happened, I have been saying this, that the government has failed the public health system. So in a country, so I was teaching my 8-year-old about taxes and how the government makes money on a school assignment. And when I mentioned to her that out of 100 rupees, I pay 40 rupees as tax. And in America, people pay half the amount as tax. She instantly jumps to the solution that, Mama, if the government has surplus money, I'll put it into healthcare. Now, if an 8-year-old can understand that, I don't understand how a government who's been long-standing for so long chooses to look away from healthcare as being the primary crux of the reason why our economy is failing. If you're not going to have a healthy workforce, you're not going to have healthy doctors, you're not going to have satisfied healthcare workers. The reason for a lot of corruption in medical practice may also stem from the fact that doctors are not getting their due. And somewhere out of frustration, some people take the path which is easier, which may not be appropriate. Many of us may choose to resort to alternate methods and not these ways of making money. But when it comes to losing lives and carrying infections home, I think that's the last straw. And, a lot of my batchmates and discussions on other groups used to go on this trend that why should we volunteer, especially when that notification came out that everybody who's a registered medical practitioner or not working will be forced to volunteer. And I went out and told people that, you need to be there and this is your calling. And a lot of them turned around and said that, it's to each their own and you're nobody to tell us. And I really do think that maybe somewhere down the line, they were right. When I look at stories of Dr. Sanket Mehta, I really wonder that, how justified are we to ask somebody to make a sacrifice like this, which is not a sacrifice of himself, but he's actually sacrificed his entire family and the future of his children and his family.
Yes. I just want to read out some of the messages that are coming in, and I want to thank our viewers for the support. Johns, Paul, Apurva, Pradyu Reddy, who sends his support. Ritain Avasti, Lilith, who asks, when will we have home testing kits? Neeraj, Rajshri Ghosh, Bharat Raval, Jagan, Vijaya, and many others, and I'll get to the rest of them. Also, taking this now to Ravi Duggal. Ravi Duggal, I am deeply disheartened and also a little angry, because technically there are two aspects to this. One is the insensitivity of the fact that, we've had the Prime Minister come out over and over again and talk about, there's this massive sacrifice that the healthcare workers and the doctors and the nurses are making. We've had, like we said, plate banging and candle lighting and flower petal showering on hospitals. But all of that means nothing if their names are not going to be counted, if their compensation is not going to be, if the government hasn't found it important enough to put together this data before Parliament. In fact, my team and I have tried to gather as many names as we could from the news reports and the newspaper reports that are available, and we'll start putting those names up on the screen, because these are people who should be acknowledged for their sacrifice. But Mr. Duggal, there are also ASHA workers, nurses, who the IMA is not counting, because the IMA is an association of doctors. What happens to those names? Those names will just get lost. These people will just get lost.
There are also doctors and healthcare workers who suffered a severe COVID and they've come out of it, but that has been mentally and physically traumatizing. What about those names? Those are also those are also not in the list. And when you keep talking about thali banging and all, I have serious objection to that, because that's something which was tailored. It was fabricated. It was very artificial. Okay, when those same things happened in Italy and other countries abroad, it was something spontaneous that the nations came out with. Here we had a whole show of things, people doing garba on the road. I don't think it was any kind of gratitude that came from inside.
Let me just go through these names. Dr. Melaram Bansal was 81 years old from Batinda in Punjab. Batinda's oldest surgeon was working until he tested positive. He was lost to the disease. Dr. Mohammed Mir from Srinagar in Kashmir was at the forefront of the battle of COVID. He was treating patients for 4 months before he was lost to the disease. Dr. Lokesh Gupta, age 60, Dadri, Uttar Pradesh, general physician who ran his own clinic, had diabetes and hypertension, but continued to work and was lost to the virus. Dr. Pankaj Kumar Chaudhary, aged 40, Mumbai, Maharashtra, involved in screening and treatment of COVID patients, was providing free service to the city's fever clinic and was lost to the virus. Dr. Jogendra Chaudhary was 27 years old in Delhi, a farmer's son who wanted to set up his own hospital. His colleagues had to raise funds for his treatment because obviously the funds were not available. Mr. Duggal, how distressing is this?
Yeah, I mean, certainly, I mean, these individual cases that you've highlighted, definitely one sympathizes with their families. The same is true for nurses, for other health workers, sanitary workers, the police force, etc., who have been in part of the front lines of the situation that COVID has created. But that apart, I mean, I have a slightly different perspective on this. Yes, I mean, all these lives do matter ultimately, and because they are providing services that often can lead to human lives being saved. So in that context, I think if you look at it in a larger perspective, you can say the same about farmers, about the migrants, and so many other people. So it's not the question of data not being there. The data is there, and this government has actually been trying to manipulate a lot of the data. They're also suppressing data. I mean, the government is becoming less and less transparent. I mean, just to give an example, we have the health management information system, which gives you all the data that you need for the public health system, and even some bit of the private private sector data on healthcare of certain programs, for example, in which the private sector is involved. So we do have a fairly robust database. It's not the best that we compared to other countries, but it's still there. Now, as of June, they have stopped updating that data. You know, in fact, it's good to learn from this whole COVID experience in how the government is putting out real-time data. I mean, daily updates, and so the capacities are there, but I think data is not given the importance and relevance. Because if we had good, robust data, we could have surely planned much better. We could have saved many more lives. So yes, I mean, it's unfortunate. A lot of doctors' lives, nurses, lives of nurses, etc., have been lost, and one stands with them. But I think there was a point which the IMA person made about that we don't have a kind of a system which can support everybody in terms of social security and benefits. I think the fact that if we had a national healthcare system like the NHS in UK or the national health insurance in Canada, then these issues would not arise because everybody is taken care of. It's not about doctors or nurses or our bureaucrats and politicians are the best health service in this country under the CGHS. So we have a highly segmented healthcare system. And I think that is what has created all these problems. There's a separate service, the healthcare service for the defense. There's separate service for central government employees, for state government employees. But for the Aam Janta, the healthcare services are very poor quality. I mean, just look at the economics of it.
Right.
The government spent 1,500, 1,600 rupees per capita.
Yeah, so that's
okay, for the general health services. But for CGHS and defense services, it's over 8,500 rupees per capita.
No.
So that's the kind of gap.
Dr. Tandan, go ahead.
No, that's the point I'm trying to make, that we don't have an organized healthcare system despite the amount of taxes we are paying. And really, you know, we have indigent class for the patients who are BPL, who get 10% of private hospital beds. But what happens to the poor middleman, to the middle class? And what happens to the doctors, the general practitioners who charge 100 rupees for a consultation? And if they're not doing cut practice, they're the ones who don't get covered anyways. And you know, in your rebuttal, you mentioned about kisans and farmers. So while my sympathies go out to the farmers as well, but they are not to be mentioned in the same breath as people such as doctors and security guards who have put their lives out there for somebody else.
I don't wholly agree with that, but what I'll say, what I'll say,
you're getting a point we're trying to make, that here somebody is putting.
I think everybody's life is important. It's not.
Yes, everybody's life is important. Yes, everybody.
And the other thing which I don't like is calling doctors and nurses and other frontline health workers as warriors. They are not warriors. They are providing an exceptional human service. There's a poem written by a nurse, a Punjabi poem, which says that don't call us warriors. We're not soldiers to go and shoot down people. So I think let's see it differently.
No, Mr. Duggal, I disagree with you for one reason. During COVID, when we knew very little about the disease, when our hospitals were overrun, when the ward boys and the cleaning staff was not showing up to work in Mumbai, at least because I was in those hospitals, I visited those hospitals. They were nurses who were cleaning. They were nurses who were emptying bedpans. They were nurses who were doing the job of, and doctors who were, and residents who were doing the job of ward boys. They could have stayed home out of fear for their lives as well. We all stayed home. We all stayed in our houses. We didn't allow anybody into our houses. We sanitized everything that was coming in and out. But here were people who went out saying, you know what, this is the moment when citizens need us. We're going to go out and do this. We asked for a sacrifice from these doctors.
That's why I was saying that social security on a universal access basis is essential if you want everybody to be treated with equity.
We don't have universal health care. At least if you're providing it to your army, you provide it to the people who you're calling warriors.
That's precisely what I'm saying.
You can say that don't call them warriors.
Precisely. And the reason we don't have a national health system is because we have a very large private sector, which is out there in the market, which is making money. Okay. I think let's look at it in this perspective.
Mr. Duggal, I think you need to relook what you're saying. Right now, nobody is making money in the healthcare sector.
Oh, come on. There's so much of data.
All right.
There's so much of data. People's bills have been published. So.
All right. You need to see the BMC rates, the GIPSA rates. Patients are getting ICU beds at 7,500 rupees, all inclusive. In COVID.
Okay, one second. We're getting a little derailed. One moment.
That private hospitals make
that is only on paper. The reality is different. Anyway, this is not part of the debate.
One second, Mr. Duggal. One second.
Yes,
One second. Let me bring in Dr. Bagai. Dr. Bagai, I think, while we are talking about, gathering of data, while we're talking about universal healthcare and looking after the doctors who get sick, looking after the nurses, the ward boys. I remember being at government hospitals in Mumbai where the ward boys told me that, when we get sick, they tell us to sleep on the floor in the corner. We don't even get a bed. That's the kind of treatment we get. And there's obviously a structure or a hierarchy in how these healthcare workers are treated as well, which is why they turned around and said, we're not coming back. We're not going to come back to work. We'll do something else, but we don't want to do this. It's too dangerous. And I remember the pressure that it put on the people who were running these hospitals. It put on the doctors who were in the ICU, the resident doctors, and of course, the nurses. But to have the government now turn around and basically treat it like none of this really happened and it was the state's problem and it was not a national sort of battle that was fought and is still being fought. It actually takes the argument beyond insurance. It takes the argument beyond data. It takes the argument to priority. And the statement that the IMA has made saying that the government no longer has the moral authority to administer the Epidemic Act and the Disaster Management Act if they're not going to collect the data. Do you agree with that point?
We can dissect the politics of it and we will not reach anywhere. Data is important. Data analysis is extremely vital. There is a saying that if you give me a little bit of data, I'll give you a little bit of information. If you give me all the data, I'll give you the world. So the data talks to us. I think it's important because it gives us a trend, it gives us information, it gives us a predictive value. It tells us how much we need to cover more in terms of a gap in terms of need analysis. But on a larger base, I think not only India specific, but chronic underfunding of public healthcare and preventive healthcare has killed the world. I mean, the cracks were already there. COVID has only exposed it. And but like I said, healthcare is never an expense which the government should do. Healthcare spend, which needs to be doubled clearly, is truly an investment. The amount of money which we will save in keeping the population healthier is much better in every evaluation manner than the amount which we are spending to treat the illnesses. I think we have a long gap to cover. We can, there is no point in criticizing because these are unusual times. We've had no experience in dealing with a pandemic, at least in our own living memories. But the doctors really, the core issue is the doctors, and I want to add in a very, very strong manner the nursing staff. You see, there is no voice of the nursing staff in India. Some of the doctors like us can be vocal and explicit in mentioning what we are doing because we have a social standing, but very rarely. And Faye, from the bottom of my heart, I really request you call some of the nursing staff. It'll be heart wrenching to hear their stories. They stand, they have no place to sit. Very often they stand throughout the night. They get bulldozed by the doctors, which includes people like me. They get the wrong end of the stick from the patients. They come from humble backgrounds. They are young girls, young boys in the early 20s. They get paid very meager salary. And that comes to two parts, which I would like to make very quickly, Faye, is that the doctors must, inclusive of government and private, please understand that the corporate hospitals do not give any perks to even the senior most doctors. Doctors are very often a dispensable commodity. I think that era is going to change post COVID. I think a lot of the medical fraternities at the present moment keeping quiet. Very large corporate hospitals are actually doing what they are doing. I'm not using the word profit and I'm not using the word profiteering, but I think that's going to change because it's going to be clinician run in a larger manner. That change will come. A lot of people may put a question mark on what I'm saying right now, but that change will come. The doctors need perks. The doctors need to be looked after better. I think there must be a uniformity nationwide of doctors' pay scales. You can't have resident doctors in West Bengal paid lesser than in Maharashtra or more than in Punjab. That's ridiculous. That's so Jurassic Park that you can't believe it. I think we need a national policy of especially the young doctors. What is the incentive of them? If they can't make a living, it's ridiculous. I think we need to look at nurses' pay scale. I think the nurses need to be paid a lot more. That's why nurses are not well respected in India in many parts. In some parts, yes. And lastly, what I would really request is we must make at a national level from the government a welfare fund. We must look after the doctors who are GPs who have retired, who have no source of income. People who died, their family has no source of income. They have no insurance. They don't even have money to treat their own illnesses. I think we need to, in a way, look after the doctors. Just look what happened in KEM few days back. There was a young animal who wore a cap, who knew how to operate a ventilator better than the ICU doctors. And even though his relative had unfortunately died, abused the doctors and the medical staff as if they were cockroaches. I don't think that should be allowed. If he's there on every social media, I think this is where we need to come in as a society, as a government. Hold these people, put them behind bars, period. Finished. I think doctors cannot be assaulted, doctors cannot be abused. We have sacrificed our youth, we have sacrificed our life, we have sacrificed our families to save human lives. Human life can never be equated with money. It can never be equated with a statistical number. Doctors have done I think the medical community in India has stood up extremely tall and extremely strong in moments of great crisis with very meager resources. I'm not talking of financial resources. I'm talking of medical resources. I think we've done a fantastic job without thinking of what the consequences are, and therefore these 570 odd deaths. But I think we need to look after the doctors. This is the time in which we all need to rally. Again, I'm saying maybe for the third or the fourth time in the show, without looking after the nurses, we will not get good nursing staff. And that's your backbone to give clinical results. Very often the doctors hog the limelight. Have you ever heard a nurse being praised? Have you ever heard of a nurse coming on national television and being applauded? Have you ever heard of a nurse coming and expressing her grievances? No. I think the nurses need that recommendation. They need that moral and financial support to give us better clinical results. If India is going to become number one in healthcare, which I have no doubt that we have the talent, what we need to do is a little bit of mental restructuring. We need to change our mindsets. Doctors should not be treated as a whipping boy of society. When everything goes wrong, hang them guilty. And when they're doing it, everything is right, then they should not be treated as thieves. I think the doctors also have a right to earn their livelihood, but in a correct and appropriate, ethical and honest manner. But I think doctors need the respect more than anything else, and not being bullied, abused. You should see the incidents in KEM 5 or 6 days back. I have it. I'll send it across to you. It's so terrible. It's unacceptable.
I couldn't agree more. You've hit the nail on the head. So most of us who have trained abroad will tell you that the one big difference, there is no difference in skills, but the one big difference between working abroad and in India is the respect which you show to your nurses. A nurse can turn around and tell you, doctor, you're wrong.
Can I please take your leave? I have a call beginning in 10 minutes. Can I please take
Dr. Bagai. Yes, Dr. Bagai. Thank you.
Thank you, Faye, and good evening to all the panelists. My apologies for leaving 10 minutes earlier. Thank you, Faye, for having me.
Yes. Dr. Tandan, go ahead, please.
Yeah, so I completely agree with what he's saying, because I think the bigger brain drain in India, we talk about brain drain with respect to doctors, but the bigger brain drain is with trained nurses. And I do agree that it's very rare to have a nurse come up and talk about her experiences. But when an ICU patient recovers, I tell the nurses time and again, but they don't get credit from the family. Seldom do they get credit from the patient. It's 95% of nursing work, 4% of work from the residents, and 1% of my inputs. If you ask me, that's really the graph. I come there maybe for a couple of hours a day, but the nurses are the ones who are literally standing on one foot and ready to help and ready to pitch in for whoever is missing from the role. I think if we start respecting and paying our nurses better, backing them up, we are not going to have this huge efflux of nurses that we have. And this is a long drawn battle across private as well as public hospitals. Even private hospitals don't pay their nurses well. I think Mr. Duggal will agree with that.
Right. Unfortunately, we have run out of time, but we will keep coming back to this as we have. Like I've kept telling you over the last 6 months, there are 3 developing stories, the most important of which is COVID. Our audience is pointing out that when we had, 500,000 cases, there weren't enough beds. Now we have these many cases. Where are the beds coming from? Where are the doctors coming from? Where are the nurses coming from? The sacrifice that has been made by healthcare staff, doctors, nurses, ward boys, ASHA workers, is beyond the call of duty, is beyond the call of profession. What we have asked them to do as a country, we should be conscious of. What they have chosen to do as professionals, we should be conscious of. It would have been very easy for them to stay home, for them to not put themselves at risk, not put their families at risk. Some didn't see their families for months on end. Resident doctors were working full shifts in PPE while also studying for their examinations and not getting paid. The fact that we today pretend like COVID is behind us, which it's not, the fact that we pretend that the sacrifice made by these doctors doesn't count enough for the government to make a plaque with their names and put it up on a memorial, just get the data, is shocking. It's deeply, deeply distressing. At the end of the day, these are lives that are lost. And I just want to give you an example. The government has a different number. The IMA has a different number. Dr. Bagai just called out a different number. The fact that we don't even know how many doctors have died. We don't know how many nurses have died. We don't know how many ASHA workers and ward boys and cleaning staff have died during COVID. Doesn't look good on us. It's embarrassing and it's deeply saddening. And I hope this is something that is only an oversight by the government and not a reflection of the fact that nobody in administration really cares. We might be suppressing this and looking at movie stars instead and talking about drug abuse instead, and that's fine, and that's the priority of other journalists. But at the end of the day, All of us today who are alive and well, because our doctors and cleaning staff and nurses went out and did what they needed to do, need to demand better from our government. It is unacceptable that this has happened and we have not said anything about it. We shouldn't have to have the doctors come out and demand respect. We should demand it for them. Look at the amount of noise that gets made, and quite rightly, if we feel the army is not being given the respect it deserves. Siachen mein jo jawan khade. This is very similar to that. And under normal times, a year ago, we could have had an argument with the doctors about their commitment. Now, no more. Because we asked from them, the supreme sacrifice. We took it. And then we turned away. Shame on us. Thanks for watching. Good night.